Thank you, Richard. So we've heard a lot today about solutions, all boiling down to one basic principle. The problems, it seems, all originate from government. The solution is less government. The solution is winding down the role of government in healthcare, whether it's drugs and therefore winding down the role of the FDA, whether it's costs associated with the increased involvement in government through Medicare and Medicaid, whether it's the inability of people to get insurance as a consequence of all the mandates and the inability to cross state lines, and on it goes, where the evidence is just overwhelming. Government involvement in healthcare causes problems. It causes costs to go up, and it causes quality to go down, just like government involvement in pretty much anything else. What's the surprise here? And there are lots of solutions out there, as has been mentioned. We could give tax credits, we could allow people to go across state lines, we could eliminate mandates, we could reduce the role of the FDA, we could get rid of the FDA. There's solutions to all these things. We even can look at other countries where greater government involvement has been tried, where when somebody, during the Q&A previously, challenged us to do this to Canada and to Germany and to UK and other countries. The evidence is there. There's no challenge here. Just go. Go see what socialized medicine looks like. Plenty of studies have documented the disaster that is the Canadian system and the UK system. I happen to have lived most of my life in Israel, a country with socialized medicine and lots of doctors for obvious reasons. We're all Jews. More doctors per capita than any other country in the world by far, and yet my father, who was also a physician under socialized medicine, when there was a serious case where somebody had money, he would fly them to the Mayo Clinic. He would fly them to the US. So the results of overwhelming socialized medicine and greater government involvement in healthcare don't work. And yet, and as we heard earlier in the panel, Obamacare is unconstitutional, and nobody seems to care about that either. So something's going on here, right? Here's a system where government involvement is wrecking it, and the solution is more government involvement. Here's a system where we can see plenty of evidence in other countries that more government involvement is bad, and yet we pursue that path anyway. Here's a system that goes against the principles on which this country was founded, and yet we ignore those principles. So why? And again, none of this is rocket science. None of this is rocket science. I would argue that these are almost, not quite self-evident, but these are open facts available to anybody who's willing to go out and be honest about looking at the system here and the systems in other countries. I would argue that the healthcare debate is not, no matter what everybody talks about, costs and efficiency and so on, is not a debate about healthcare, but ultimately a debate, as Dr. Lewis mentioned, about morality. This is fundamentally an issue of whether you have a right to healthcare. Even more fundamental than that, this is ultimately an issue about whether you are sovereign over your own life. Is your primary moral responsibility to yourself, to the pursuit of your own life? Or is your primary moral responsibility to the well-being of others? We live in a culture in which, since we were so big, very, very small, little, for those on the video or audio, we have been taught and taught and taught that our moral responsibility is to take care of others, that our moral obligation is to make sure that others don't suffer, that their needs are met. In other words, we've been taught since we were very little that our lives belong to any other group, any group out there that has needs, that is suffering, that demands health care, that needs health care. So our lives are not ours. And if our lives are not ours, they're the lives of other people. And it doesn't matter what the Constitution says, and it doesn't matter how much it costs, and it doesn't matter whether doctors are going to quit or not quit or what the efficiency of all this. There's a group out there that needs stuff. And it's our obligation to provide it. And all the government's doing, after all, is helping us along just a little bit. It's helping us meet our moral obligations. And the only difference between the Democrats and the Republicans on this point is the Democrats are far more consistent. They get it. They understand it. They're not embarrassed by that fact. Obama doesn't care about the quality of health care that you get as long as those people in need get what they ethically deserve, which is better than what they're getting right now because they're not getting any, supposedly. Every single health care bill that has passed from the beginning of government involvement in health care has passed because somebody's needed to be met. Poor people weren't getting the health care like middle-class people. And there was a perception that the health care was not very good, and they needed better health care. So we passed Medicaid. Old people weren't getting the best health care they could get. They had a need. And since we all have a moral obligation to supply that need, we have Medicare. Children who weren't quite poor enough to get Medicaid, but weren't quite wealthy enough in the middle class to, I guess, buy insurance, were left in this gap. They needed health care, so we get CHIP, the government policies that provide health care for children. And right now we have 30 million uninsured that need health care, that need insurance. So we've got to give it to them. There is no question. It's our moral obligation, and to hell with costs. So if we accept this morality, if we accept the morality that our life, our moral obligation in our life is to others, that need determines our actions, determines what we should do from a moral perspective, then it's all over. Then there's no, solutions, Constitution, it doesn't matter. It really doesn't matter. So this battle over health care is not fundamentally a battle about the practicality of this or that system. This is a battle about whether you are sovereign over your own life. If your moral obligation is to yourself or to others, are you your brother's keeper? Because if you are your brother's keeper, then you might as well provide him with health care. That's your moral obligation.